Have you ever noticed how white teeth can completely transform a face? A bright smile radiates health, confidence, even youth. But the beauty industry has turned that into a luxury. Laser whitening, imported strips, and so-called miracle toothpastes are expensive, and many of them end up damaging the enamel and gums instead of helping. The good news: science has already proven that you can safely whiten your teeth at home, effectively, affordably, and with just 2 simple ingredients that cost less than a cup of coffee. Today you're going to learn how to make your own natural whitening paste, why it actually works, and what mistakes you must avoid if you don't want to harm your smile. And stay until the end, because I'll also reveal an ancient ritual from the East, a natural method that kills bacteria, reduces inflammation, and can completely change your oral health. The power lies in the right chemistry. When we talk about tooth stains, we're not just talking about cosmetics. Those stains are the visible proof of pigment buildup and bacterial biofilm that your body could not clear on its own. Coffee, tea, red wine, tobacco, even the natural oxidation of aging, create molecular chains that cling to your enamel like a thin, invisible layer of rust. To dissolve those stains, you need something that breaks those chemical bonds without destroying your teeth. That's where our 2 heroes come in: baking soda and hydrogen peroxide, 3%. Baking soda is gentle and non-abrasive. It works like a micro-polisher, loosening surface stains and reducing plaque. Hydrogen peroxide, on the other hand, is the real whitening agent. It releases active oxygen, breaking apart the molecules responsible for the yellow tint. Here's something most people don't know. The secret isn't a tea just using these ingredients. It's using them in the right proportion. High concentrations of peroxide, like the ones used in dental clinics, often above 30%, can dehydrate enamel and irritate gums, leading to sensitivity and even microscopic cracks. The home version, with only 3% concentration, is both safe and effective, as long as you use it consistently and carefully. Simple, safe recipe. Write this down: 1 teaspoon of baking soda, 3 drops of hydrogen peroxide, 3%, 8 drops of filtered water. Mix everything until it forms a smooth paste. Using your toothbrush, gently apply it across the surface of your teeth, both outer and inner sides, and brush for 1 to 2 minutes. Then rinse thoroughly. This mild chemical reaction releases oxygen and breaks the pigment chains attached to your enamel, gradually revealing a cleaner, brighter color. As a bonus, it also helps reduce bacterial colonies and prevents plaque formation, one of the main causes of bad breath. But here's the catch: doing it once won't perform a miracle. Because this is a gentle method, it requires consistency. Use it 2 to 3 times a week, and within a few weeks, you'll start noticing a clear difference. Most importantly, it's painless, non-sensitive, and won't harm your enamel. The mistake that ruins: so many smiles. Impatience. People often think that if a little works, more will work faster. But when it comes to chemistry inside your mouth, that's a dangerous trap. Professional whitening treatments often use peroxide concentrations above 30%, combined with ultraviolet or LED light to speed up the reaction. But that also amplifies the damage. This combination can dry out your enamel, cause gum recession, and even create invisible microcracks in your teeth. That's why the real secret is to whiten gradually and intelligently. Because it's not just about having whiter teeth, it's about having healthier teeth. The ancient ritual science has rediscovered now. Here's a fascinating twist. Long before modern toothpaste was invented, ancient civilizations in India and Southeast Asia practiced a natural oral cleansing technique called oil pulling. They originally used sesame oil. But centuries later, coconut oil proved to have the same benefits, with a far better taste. The technique is simple but powerful. Take 1 tablespoon of coconut oil and hold it in your mouth for 10 to 20 minutes, gently swishing it between your teeth like a slow, mindful mouth rinse. Then spit it out, never down the drain, and rinse with water. It might sound strange, but there's real science behind it. Coconut oil contains lauric acid, a natural compound with strong antibacterial and antifungal properties. It helps eliminate microbes that cause bad breath, inflammation, and gingivitis. Recent studies have shown that this method is as effective as commercial mouthwash, but without the alcohol and harsh preservatives that irritate your mouth. Practicing oil pulling 3 times a week can not only freshen your breath and polish your teeth, but also reduce biofilm and toxins inside the oral cavity. You have probably heard of leaky gut, when the lining of your intestines weakens and starts letting unwanted particles into your bloodstream. But what most people don't realize is that the same thing can happen inside your mouth. Dentists call it leaky gums. Yes, your gums can literally become a gateway for bacteria to enter your blood. And the worst part? It happens silently. A little inflammation here, a small bleed there, until one day your gums are no longer protecting you. They're leaking. The hidden trigger. Sugar. It all begins with sugar, the favorite food of oral bacteria. They thrive on it, multiply, and release acids that erode enamel and irritate gum tissue. Over time, that irritation creates tiny gaps between your teeth and gums, microscopic openings that lead straight into your bloodstream. But the real problem isn't just the cavities or the bleeding. It's a biochemical competition happening inside your body between sugar and vitamin C. Both molecules are chemically similar, and your cells can only absorb one at a time. Guess which one wins when sugar floods your blood? Exactly. Sugar blocks the gates. Too much glucose prevents vitamin C from entering your cells, and that's a disaster for your gums. Because vitamin C is what your body uses to make collagen, the protein that keeps your gum tissue firm and resilient. Without enough of it, your gums become soft, weak, and prone to bleeding. That is why people who eat a lot of sugar or chew sweet gum often notice their gums turning red or tender. It is not coincidence. It's chemistry. When gums leak, the whole body pays the price. Once those microscopic gaps appear, bacteria that normally stay trapped in your mouth can slip into the bloodstream, and they don't just vanish there. They hide inside arterial plaque, trigger inflammation, and have even been found in the brains of Alzheimer's patients. Yes, you heard that right. Scientists have discovered oral bacteria inside arterial blockages and brain tissue. That means gum disease isn't just a cosmetic problem. It's a systemic health issue linked to heart disease, stroke, and dementia. Your mouth is not a separate system. It's the front door to your entire body. So, what causes this chain reaction? 2 things. Too much sugar and not enough vitamin C, the vitamin that rebuilds your gums. Here's the good news. You can reverse it. When vitamin C finally reaches your cells, it acts like a molecular repair crew. It rebuilds collagen, tightens the gum barrier, and seals those microscopic leaks. That's how your body naturally protects you from bacterial invasion. But there is a catch. You can just take a supplement and keep eating sugar. If glucose is dominating your bloodstream, vitamin C will still be locked out. So the first step to stronger gums isn't adding, it's subtracting. Cut back on sugar and refined carbs, and suddenly your body can absorb the nutrients it's been craving. The healthy mouth diet. Think of it as nutrition for your teeth. Every bite you take either feeds bacteria or feeds the tissue that fights them. Foods rich in vitamin C like kiwi, strawberries, bell peppers, and broccoli rebuild collagen and stop gum bleeding. Meanwhile, sugary snacks, sodas, and gum destroy that balance, fueling inflammation. Add magnesium from leafy greens and nuts. It helps strengthen the jawbone and stabilize your teeth. And don't overlook hydration. A dry mouth is a bacterial paradise. Water supports saliva production, your body's natural antibacterial rinse. The conscious oral routine. Now that you understand the chemistry behind a healthy smile, it's time to turn knowledge into habit. Here's the ideal daily ritual. Physical cleaning. Brush with the mild baking soda and hydrogen peroxide, mix 2 to 3 times a week. On other days, use a gentle toothpaste free of harsh foaming agents. 2. Biological cleaning. Practice oil pulling with coconut oil 3 times a week, especially in the morning before breakfast. It naturally reduces bacterial colonies and freshens breath. 3. Nutritional repair. Eat antioxidant-rich foods and keep your vitamin C intake high while minimizing sugar. This strengthens your gums from the inside out. Together, these 3 habits form a complete oral health protocol. one that cleanses, heals, and protects your mouth on every level. A younger smile, a younger body. A healthy smile isn't just about vanity, it's a sign of metabolic youth. Research shows that people with good oral health have a lower risk of chronic inflammation, arthritis, dementia, and even some cancers. That because inflammation often begins in the mucous membranes. And your mouth is the first line of defense. Firm, pink, non-bleeding gums mean your cells are getting oxygen and nutrients efficiently. And that inner balance radiates outward. In your skin, your energy, even your mood. Your mouth mirrors your biology. The final hack. Consistency over intensity. Oral health isn't built overnight. It's not about dramatic transformations. It's about daily discipline. A 2-minute ritual done consistently will outlast any expensive, one-time procedure. Think of it as training for your smile. Every gentle brushing, every day you skip the sugary snack, you're rebuilding collagen and reinforcing your body's defenses, one molecule at a time. You don't need luxury treatments to have a radiant smile. You just need to understand your own biology and use it wisely. Baking soda, gentle peroxide, coconut oil, vitamin C, and sugar control. Together, they form one of the most powerful, affordable oral care systems in existence. Because what happens in your mouth doesn't stay in your mouth. It echoes through your entire body, from your heart to your brain. So if you want to transform your health, start with the mirror. Your smile is more than a reflection. It's your body's way of saying, I'm thriving. If this video surprised you, share it with someone. Leave a comment. And don't forget to subscribe to the channel. Support our channel. Find out how in the first pinned comment below.